my dear colleague, Professor Ahmed Alolemy, who will be the first speaker. He will give the first plenary lecture about complementary medicine overall view. Professor Ahmed really is a unique professor. He is a professor of public health in Tanta University, and he is the head of training department in Saudi Arabia. Research and training complementary medicine institute in Riyadh, and he has a lot of publications in field of complementary medicine and infection control, and he's an advisor of training of medical students on practice aspect of epidemiology, primary health and services. And he reviewed many national and international, he's a reviewer of many national and international journals. And really, in my opinion, he is one of the most knowledgeable persons, I may say, in the whole world about complementary medicine. Thank you, Professor Ahmed, for your lecture in advance. And I'm sure that you will give us wonderful information. The microphone is yours, Professor Ahmed.
Thank you very much, Dr. Mohammed. بسم الله الرحمن الرحيم والصلاة والسلام على أشرف المرسلين سيدنا محمد النبي الأمي الكريم. Thank you very much, Professor Mohammed, for this smart introduction for myself. I will speak about the traditional and the complementary medicine and overall view. We will speak first about the definitions of traditional and the complementary medicine and related terms, describe different classification of traditional and complementary medicine modalities, demonstrate utilization of traditional and complementary medicine practice either worldwide, especially in Palestine, Kingdom of Saudi Arabia, and their impact, know who, why, and when traditional and complementary medicine used. Then we will define the integrative medicine, describe principles, benefits, advantages, and the models of integration. First of all, what is traditional and complementary medicine? There are many related terms related to the complementary medicine. It may term non-conventional medicine, alternative medicine, complementary medicine, parallel medicine, natural medicine, compared medicine, folkloric medicine, traditional medicine, neglected medicine, holistic medicine, authentic medicine, and the most recent is the integrative or integrated medicine. What is the definition? The National Center for Complementary and Integrative Health in USA define complementary medicine modalities as healthcare practices outside the realm of conventional medicine, which are yet to be validated using the scientific methods. So it is defined by exclusion. There is more than one definition by the WHO and other institutions all over the world, but this is the most simplest definition. Alternative medicine means the complementary medicine used in place of conventional medicine, and this is not accepted today. And the term alternative medicine is removed from the strategy of WHO in 2014. Complementary medicine means the patient has opportunity to use conventional medicine with non-conventional medicine or complementary medicine, but the government didn't have the responsibility for the availability of these practices. While integrative medicine combine the best of conventional medicine with the best of complementary medicine at the same healthcare facility without extra costs on the healthcare system. What is the impact of traditional and the complementary medicine? Surveys done show the marked increased use of traditional and the complementary medicine in the past 50 years, either in US or in other industrialized countries. In a survey done between 1990 to 1997, showed US households reported increased use of traditional and the complementary medicine from 34% to 42%. And the most evident is more visits to CAM practitioners than to all primary health care providers. In another survey done by the CDC in 2004 reported 26% of US adults use some form of traditional and complementary medicine, 55% use the traditional and complementary medicine with conventional treatments, and the most surprising that 26% use the traditional and the complementary medicine because a medical professional suggested it. It is referred from health professional. The survey done also by the CDC in 2007, they found that four out of 10 adults and 1 out of 9 children use the traditional and the complementary therapies in the last 12 months. What is out-of-pocket spending on the complementary medicine products? European Union reported about $5 billion on CAM products in 2003, Australia about $2 billion in 2005, USA about $34 billion in 2007, and reached up to $83 billion in China in 2012. What is the prevalence of traditional and the complementary medicine worldwide? Look for the map in front of you. The dark green color represents the high use of complementary medicine, light green represents moderate use, yellow color represents either low use or no data, white color represents no data. When we look for this map, we find that most of the world, either industrialized countries, developed or developing countries, either high use or medium use. North America, South America, most of Europe, Asia, Australia, most of Africa, either high use or medium use of complementary medicine practice. However, the picture in low-income countries with low limited resources, the use of CAM may reach up to 90% of the population in countries such as Ethiopia, 70% in Benin, India, Rwanda, while in some industrialized countries also the CAM use may reach up to 70%, such as in Canada and in Germany. The CAM practices that highly used, according to a report of 2004 by the National Center of Complementary and Integrative Health in USA, they reported 43% using a self-prayer, 24.4% using a prayer for others, 19% use the natural products, 11.6% use deep breathing, 9.6% use praying, group praying, praying for others, followed by meditation, chiropractic, yoga, and so on. In another survey done in 2012 shows the most common CAM practices used by adults, natural products on the top, followed by deep breathing, yoga, tai chi, or qigong, chiropractic or osteopathic manipulation, meditation, massage, and special diets. What is the picture in children? According to survey done also in 2012 in children, they found the most common CAM practices, including natural products on the top, followed by chiropractic or osteopathic manipulation, yoga, tai chi or qigong, deep breathing, homeopathy, meditation, special diet, followed by massage therapy. What are the picture in Palestine? In a survey done in Palestine in 2021, they reported about 72.8% used one type of CAM during life, about 52% use herbs, 71.7% satisfied with CAM use, with the results of CAM use, while 68% didn't disclose their use to your physician or pharmacist. In another survey done for CAM use during pregnancy, they reported 91.5% reported use at least one method of CAM during pregnancy, 87.7% used one method of biologically based practice, and 26% using one type of herb. The picture in Kingdom of Saudi Arabia is nearly the same. 73% of patients use any CAM before, 67% of patients use CAM during the last year, and 72% keep some herbs in their home. Another survey done in 2012 among the general population and not the patient. Among general population, they reported about 59% use medical herbs, 55% use either spiritual herbs or honey and tea products. This is followed by hijama, cauterization, medical massage, camel milk, and urine, and so on. In another survey done on the health professional and the policymaker to measure their perception about CAM use among population, they reported that 66% reported using spiritual healing, 44% use honey and tea products, followed by medical herbs, hijama, food supplement, massage, cauterization, and acupuncture. In another survey done on the patients attending primary health care center, we found that spiritual healing on the top, which about 26.7%, followed by herbal medicine, honey and tea products, hijama, cauterization, camel milk, and urine. And all of these modalities are the traditional modalities present in our region. What are the classification of traditional and the complementary medicine worldwide? According to the National Center for Complementary and Integrative Health in USA, they classify complementary medicine modalities into 5 main groups, and this is in 2006. The highest group with high level of evidence is the manipulative and body-based practices, including chiropractic, osteopathy, massage therapy, acupuncture, followed by biologically based medicine, including herbs, dietary supplements, therapeutic diets, mind-body medicine, and this is the most prevalent all over the world, including spiritual healing, mental healing, meditation, yoga, physical exercise, psychological support, energy medicine, and this is the least evidence, including Qigong, Tai Chi, healing touch, therapeutic touch, Reiki, and so on. And the last group is the whole medical system, such as traditional Chinese medicine, Ayurveda, Unani medicine, Islamic medicine, prophetic medicine, Oriental medicine, and so on. While if we do this classification according to the level of evidence, we found the highest level of evidence for manipulative practice, followed by biologically based practice, mind-body medicine, whole medical system, and the least evident is the energy-based medicine. So the question, are traditional and the complementary medicine evidence-based? To answer this question, we'll follow the circular approach for evidence, and this is approved in complementary and alternative medicine. With respect to the conventional medicine, we first look for the researches. We follow the hierarchy of research. First, look for systematic review and meta-analysis, followed by double-blind randomized controlled trial, single-blind, open-label randomized controlled trial, non-randomized controlled trial, cohort study, case control, cross-sectional case series, case report. If we didn't find any research, because the research in complementary medicine compared with conventional medicine is very rare, so the clinical expertise and the patient value are respected as a level of evidence in complementary medicine. And according to this evidence base, WHO classifies the different CAM modalities into 3 main groups. The first group embraces what may be called the principal discipline or the big 5. This is include acupuncture, chiropractic, osteopathy, some herbal products, and homeopathy, and this is the highest level of evidence. The second group, this contains therapies which are most often used to complement the conventional medicine, such as massage therapy, reflexology, sujok, and so on. And the least evident, the third group, classified into group 3A, that include the whole medical system, traditional Chinese medicine, Ayurveda medicine, Arabic medicine, and so on. And the group 3B, this is the least evident practice, which is the energy medicine. What is the most important evidence for safety, show on the top, followed by evidence of efficacy. Also, evidence of cost effectiveness is very important. Why is the least important in the complementary medicine is the evidence for mechanism of action. And this is opposite to the conventional medicine, which do the evidence about the mechanism of action on the top. And this is what is called the reverse strategy, which is specific for complementary medicine. And accordingly, we do the framework for approaching any traditional and complementary medicine in clinical situation. We promote and use practices that are highly safe and highly effective. On the other hand, protect against the dangerous practices that is not safe and not effective. Permit practices that are harmless, safety very high, and that may help effectiveness question mark, while partners with patients and encourage communication about practices that are highly effective, while many complications are associated with it. From this point, the WHO put two strategies for complementary and alternative medicine to be implemented all over the world, especially in developed countries with low income resources. The first strategy, called traditional strategy for traditional, alternative, and complementary medicine, and this is done from 2002 up to 2005 with four main objectives: promote safety, efficacy, and the quality of care practices, increase accessibility, availability, and the economic affordability, especially in poor population, rational use, and lastly, integration of care practices into the healthcare system. The second strategy from 2014 to 2023, and this is called a strategy for traditional and complementary medicine. Hence, alternative medicine is deleted from the name of the strategy, with the main objectives enhancement of the governments all over the world to integrate care practices into the national healthcare system without extra costs on the healthcare system, especially in poor population with limited resources. The WHO report on the traditional and the complementary medicines, this is done in 2008, and the report approved in 2019, they do certain indicators for the development of T and the CM practices all over the world. Number of member states with national policy on traditional and complementary medicine, presence of laws or regulation, national program, national office, and at least expert committee in traditional and complementary medicine. Member states with national research institute, either for traditional and complementary medicine in general or herbal medicine, regulation of herbal medicine, registration of herbal products, and lastly, the population using traditional and complementary medicine. And according to the results of this survey, the first indicator is presence of national policy. The number of member states increased from 25 in 1999. It reached up to 98 member states in 2018, including 9 member states out of 21 from the Eastern Mediterranean region, and this is not including Palestine. The second indicator, national or state level laws or regulation, and this also increased from 45 to 109 at 2018. 12 member states out of 21 in the Eastern Mediterranean region, also not including Palestine. The third indicator is presence of a national research institute, and this is in 10 out of 21 member states in the Eastern Mediterranean region, also not present in Palestine. Presence of a national program, presence of a national office, a national expert committee, all of these not present in Palestine. While use of traditional and the complementary medicine acknowledged by 88% of the member states and reported among 19 out of 21 Eastern Mediterranean region. And this is the only indicator presence in Palestine. Why people use traditional and complementary medicine? According to a survey done in USA in 2004, they reported about 55% thought CAM combined with conventional medicine would help. Another 50% thought it would be interesting to try. Maybe benefit, maybe no benefit. While 26% conventional medical professionals suggested it. It is referred from health professional. Another survey done in the Kingdom of Saudi Arabia in 2012, they reported about 42% of population use complementary medicine, either due to religious beliefs or lack of side effects. Another about 28% due to failure of modern medicine in treatment of chronic diseases such as cancer, diabetes, hypertension, and more than 20% due to cheapness or effectiveness. There are both factors attract the population towards complementary and alternative medicine. Media reports of drastic results looking for cures, especially for chronic diseases, believe that CAM treatments are natural, patient empowerment, focus on spiritual and emotional well-being, in addition to the therapist providing the 3 T's, touch, talk, and the time with their patient. While there are another push factors with the patients away from the conventional medicine, including the dissatisfaction with healthcare provider and the medical outcome, side effects of drugs, high health costs, lack of control in their own healthcare practices, and the time spent with practitioner or waiting the time to meet him. While these factors is different from the population with low resources, especially in developed countries, they look for cheapness, economically affordable, easy to access religious beliefs, while the factors in developed countries is different. They use CAM because no cure in conventional medicine. Holistic approach in CAM perceived as less invasive and more natural. Negative experience with doctor-patient relationship, adverse effects of conventional medication, and palliative care. So the reason is different in poor countries. What are the diseases preferred to be treated by complementary medicine? This is a survey done in the Kingdom of Saudi Arabia in 2012. About 50% use CAM due to abdominal pain or flatulence, followed by back pain, joint pain, migraine, chronic diseases, diabetes mellitus, cancer, gynecological diseases, and so on. So what are the benefits the patient take from traditional and complementary medicine? The patients reported enhancement of immune system, alleviate pain and other symptoms, reduce stress and anxiety, treat and reduce depression, improve sleep and treat insomnia, aid relaxation of the patient, treat side effects of medication, nausea and vomiting. And all of these effects are required nowadays in the low-income countries, especially in Palestine. These effects come from using acupuncture, aromatherapy, herbal medicine, meditation, naturopathy, homeopathy, massage therapy, and the spiritual therapies. All of these practices are of low cost, so it is preferred by patients in low-income countries. The utilization of CAM is affected by, first, the availability of CAM resources, second, the accessibility, third is the economic affordability, evidence-based, and lastly, the personal experience with the effect of CAM used before. Hence, we recommend the integrative or integrated medicine. What is integrative medicine? Integrative medicine is described as more than just a sum of conventional medicine plus complementary medicine. It is a healing-oriented medicine that re-emphasizes the relationship between the patient and the physician and integrates the best of complementary and alternative medicine modalities with the best of conventional medicine modalities. So, integrative medicine integrate the evidence-based conventional medicine with the evidence-based complementary medicine at the same healthcare facility without extra resources on the healthcare system, without extra cost. And this is the most important. Beijing Declaration at 8 November 2008 recommended the governments to formulate national policies, regulation, and standards as a part of comprehensive national healthcare system to ensure appropriateness, safe, and effective use of traditional medicine. Also, they should take an action towards integrating traditional medicine into their national health system, establish system for the qualification, accreditation, or licensing of traditional medicine practitioner, and at the same time, the communication between conventional and the traditional medicine providers should be strengthened. Dr. Mickmans, when we do the pyramid of wellness, they do the base of pyramid: nutrition, the cornerstones in nutrition, hydration, exercise, rest, restorative sleep and rest, and all of these related to complementary medicine. They do foundation of optimal health, weight management, stress management, spiritual and emotional wellness, social relationship, intimacy. Most of these are related to complementary medicine. The main core of the pyramid include integrative medical therapies, both conventional and complementary medicine, while the small top include the surgery or conventional drugs. So what are the benefits of integration? Integration combines the best of conventional medicine with the evidence-based complementary medicine at the same healthcare facility without extra costs on the healthcare system, in addition to enhancement of patient-physician communication. We have different models of integration, what can be implemented in low resources or low-income countries. The first three models is the most appropriate: the informed clinician, the informed networking clinician, the informed camp-trained clinician, and this is the most important that can be implemented without extra cost, while the other four models: multidisciplinary integrative group practice, interdisciplinary integrative group practice, hospital-based integration, or integrated medicine and academic medical center, this is need most advanced, so it is appropriate for high-income countries or industrialized countries. The first model is the informed clinician, and this is the simplest type of integrative medicine. Conventional provider becomes knowledgeable about one or more complementary therapies and is therefore better able to communicate and accurately inform a patient about their use. We have an example such as the family medicine physician who become knowledgeable about herbs, supplemental therapies, mind-body therapies for conditions commonly seen in your clinics. The second model is the informed networking clinician, and this type of integration builds on the first model, adding informal referral networks with camp practitioners to the provider's growing breadth and depth of knowledge of complementary medicine. While the third model is the informed camp-trained clinician, and this model, the conventional practitioner who may or may not have already developed the referral network, but adds a specific training in camp therapies to a basic knowledge of camp, such as training for acupuncture, training for hijama, for anti-NTP products, for camel milk and urine, the traditional practice that is available in our community without cost or with low costs. So the path to change, to move to a new integrative model of care requires first assessing beliefs about healing and appreciating the value of principles of complementary care, identifying reliable resources of information about complementary medicine, and beginning to acquire knowledge, developing and maintaining methods to keeping up to date on care and integrative medicine research, communicating with patients about complementary medicine, documenting clinical experiences, and developing quality relationships among camp and the conventional caregiver, and supporting those exploring new models of care. In summary, public use and interest in traditional and complementary medicine is widespread and increasing. Most patients suffering from life-threatening diseases and chronic diseases use traditional and complementary medicine. Some evidence is already available and support use of certain CAM practices in countries with limited resources. While the available evidence in traditional and complementary medicine is limited due to different factors and further research is needed, regulation of traditional and complementary medicine is very important to ensure protection of the public and improve quality. So we recommend first encourage responsible use of traditional and complementary medicine, use of proven safe home remedies, good communication with patient and between all providers. On the other hand, discourage treatment by unlicensed practitioner, injection of substances not approved by authorities, treatment that have known adverse effects of drug interactions. Also be cautious about lack of evidence of safety and effectiveness, modern medication, and the lack of regulation of CAM and the CAM products. Thank you very much for your attention.